All right, so today we're going to be talking about some of the issues and complications that can occur after you've had COVID. And today our main objective is just to talk about exercises and ways that we can improve the respiratory system. Obviously, COVID is a disease primarily affecting the respiratory system, so the majority of the complaints you're going to be having will relate to that. So shortness of breath, cough, productive cough, or just dry cough, chest pain, issues like that. So we'll be discussing ways that we can improve each of those and address each of those domains. We'll talk about it from the perspective of the patient and then also from the clinician. So for the first part, let's just get straight to the one that most people are going to be experiencing, which is that shortness of breath or dyspnea. So there's different ways that we can address dyspnea in individuals who are having COVID. Primarily, it's probably from the respiratory system, but depending on their age, comorbidities, and what else is going on, it might be just a cluster of issues that might have occurred from prolonged hospitalization or medications. But we'll keep it simple and just see what happens when we address different breathing techniques. So for the first one we'll just use this guy right here. This is something that most people are familiar with. If you've been a patient in the hospital, you might have seen this. So this is called an incentive spirometer. If you're watching this as a patient and you have one of these, they gave you one of these, I'll go over how you can really optimize this. This is a very powerful tool if used correctly, but unfortunately it's not used to the most of its capacity. So I'll walk you through how you can really use this to improve your respiratory system. Okay. So first part, we need to just discuss about this. What is this device? So the incentive spirometer is a device. Usually it comes in different shapes and different varieties, but they all follow the same principle. They have a tube right here with a mouthpiece where you can put your mouth on, and they also have some number to kind of gauge volume. So this is just how much air is being filled up, and more or less it just correlates to how much you're blowing, inhaling. So some of them might also have another portion here, and this portion here is just to say how well are you performing, how's your performance. But you don't look at one of these on their own, you look at them both at the same time. And we'll kind of talk about the target that we want for both of these. So when you're doing the incentive spirometer, for the very first time I see the patient, I usually just have them demonstrate what they know. And based on that, we'll make adjustments. So if they do it correctly, then, it makes my job easier. We don't have a lot more to correct. But if they, for instance, do it and then they go up to, let's say, 500, so that would look like that. So they go up only to 500. So what that tells us is that they don't have very good inspiratory capacity, so they're not able to inhale well. And what you might see even before you do this is that you just notice they're taking very shallow breaths. So you already kind of had an idea what that number might be. This just gives you an objective number and also gives them a visual representation, the patient a visual representation of where they are with their inhalation. So the target then, when they inhale and it's low, I usually tell them go up maybe 500 more and tell them to work on that during the day or the next 2 days even. So until they can reach that target that's 500 milliliters, above where they were. So I usually do it that way, gradually increasing by 500. Now my target eventually is 1,500. So why 1,500 milliliters? So at 1,500 milliliters, that's really when we're able to get enough air behind our cough so we can have a very effective cough. If you are underneath that, you might still be able to produce a cough, but if you're noticing the patient is still struggling with airway clearance and really getting mucus out of their lungs, and they're below 1,500, this might be one of the areas that might be lacking and something that can really help them in the long term with airway management. So Setting that target eventually to 1,500 is really beneficial, because once they're able to get to 1,500 milliliters, then they can produce an effective cough and clear out their lungs. So next part with this, just depending on how high they go, you can change and dose to see, based on where they are, you can change it and dose it so that they can meet specific targets for whatever reason that you want. But really 1,500 is kind of that target where I say, okay, well, now they're able to clear their airways. I usually don't go, if they're going up to about 2,000 or 2,500, I'll tell them just to continue with this, just so it's a reminder and they don't get into a habit of shallow breathing. But if they're inhaling that much, it means that things are pretty good. So the next part that I look at is this part right here. So depending on how they inhale, if they inhale too rapidly, this bar goes up all the way, right? Yeah, so it goes up all the way. And then if they inhale and it's not enough, it's too shallow, then the bar doesn't go up enough. So typically what you'll see is most people will inhale very rapidly and this just shoots up. So what you want to do then is correct that and say, okay, keep it within this clear region. So that means you're just going to have to take slower breaths. So as they're inhaling, you just tell them, okay, that's good. Keep it there, keep it there. Once they go up too high, just tell them, okay, keep it down just a little bit or take it up a little bit more. So even if they're able to get up to 1,500 or even 2,000, and they're going all the way up really quickly and they're not doing that in the most efficient manner, this is where then the focus of the intervention then is to then be able to prolong that inhalation phase rather than making it so rapid. So we'll take that down, and then if they can maintain 1,500 or 2,000 and they can do multiple reps while keeping it in this range, you just had, that's excellent. You just had a very efficient and then effective treatment using the incentive spirometer. But if you're not doing that currently, if you're just doing it and it's shooting all the way up, or you're not reaching 1,500, well, this is a place that you can work on. Whether you're a patient or a clinician, this is a way that you can improve that. So this is the primary use of the incentive spirometer. It is to improve inhalation. And like I mentioned from the start, you would typically notice that a patient might need help with inspiration. Just by observing them, you will see they're taking shallow breaths and they're not taking full deep breaths when you just see them at rest. Using this device really helps them. Now, if you don't have this device, that's fine. The whole goal with using the incentive spirometer is to simply take deep breaths. So if you're just doing that normally without the device, that's fine. Research shows there's no significant difference when people use the incentive spirometer versus just working on deep breathing. Now, meaning they've been taught on how to properly deep breathe, and they're not doing it too rapidly. So if you're a clinician, you don't have access to an incentive spirometer, you can just teach them how to breathe in a controlled paced manner, diaphragmatic also, and those are really ways that you can simulate the incentive spirometer without using it. And the outcomes are similar. You still get that improvement in inhalation and prevention of other secondary complications such as pneumonia from prolonged bed rest and all of those negatives that can occur when you're hospitalized for a long time. So now let's talk about ways we can just improve and take that to the next level once you have the basics. So with the incentive spirometer, I typically start people just staying in an upright position. So while they're sitting down, and they do multiple. So position, we have to look at the position, and that's the first one we'll talk about. So like I mentioned, upright position. As the clinician, if they're doing quite fine, but there's still a region that is still problematic, let's say the left lobe, left upper lobe, left lower lobe, right lower lobe, whichever it is, you can then add this with postural positioning and put them into positions where you can improve ventilation. So think back to VQ matching. So with the side that you want to address up, Preferentially, that side's going to be more ventilated. Let's say we're targeting the left lower lobe. So when we lay on our right side and with the left side up, we're preferentially inflating or ventilating that left lobe. So you can position them there if they're having issues in this area, atelectasis or whatever the case may be, and you can have them perform those the incentive spirometer in that position. That's a way you can kind of modify it just to improve upon just the basics for the incentive spirometer. The other way that we can improve this is then with dosing and frequency, specifically with frequency. So typically you perform this 10 times an hour is what sometimes you might see most people say. And it's just spread out throughout the hour. You don't have to do it all at the same time, because what you will notice is you will start fatiguing. So if you do one every 10 minutes or something like that, that's usually fine. So the next level then is to take it to the point where you can do multiple. Let's say you do them all in 30 minutes, 10 and 30 minutes, or let's say 10 and 10 minutes. So increasing the frequency then allows them to be able to take multiple deep breaths in sequence. So what does that simulate? Well, when they're doing a higher level activity where they have to increase their respiratory rate, they need to be able to take deeper and more rapid breaths without fatiguing. So doing this is a way that you can improve that. So those are my two clinical additions to the incentive spirometer, just to improve respiratory function in people recovering from all sorts of pulmonary diseases. So like I mentioned, the frequency, increase that, and then also positioning. And that's my take on the incentive spirometer. I hope that helps. Use that with your patients. If you're a patient, I hope that helps. Leave any questions you might have on if you're having trouble using this device, and I can help you out. All right, I just want to say thank you guys for watching. My name is Ochuko Jamaraye from Outreach Project for Healthier Communities. My goal is to help out people who have issues with cardiovascular or pulmonary issues, just to address some of those issues that are limiting them from living full and healthy lives that they desire. I think anyone has the potential to live a greater life functionally than they are, and I would love to help people to achieve that. So if you're interested in following some of the work that we do go ahead and follow our pages. Thank you for watching once again. Let me know if you have any questions. If you're looking to work with us, we would also be looking forward to that. So thank you once again, and have a good day.